In this video, I share the script I use to provide education to someone who is preparing for a major lower limb amputation. I usually have this conversation with the patient as part of a pre-rehabilitation program. The information in this video is based on my knowledge and personal experience as a rehabilitation physician. This video is purely for general educational purposes. It is not intended as medical advice. Every intervention should be applied under the supervision of an appropriate professional, taking into account the individual situation and the available resources at the time. Who is this information for? This information is suitable for professional health clinicians who want to gain an understanding of what might be discussed between a rehabilitation physician and someone expecting an amputation. If you are a person anticipating a lower limb amputation, please seek professional advice. So here is my script. I would first introduce myself and declare my intention. I am Dr. X. I'm a rehabilitation physician. I see patients before but mostly after their amputation, and I'm here to explain the potential plans after your amputation and to answer any questions that you might have. Then I would talk about the indication for amputation. Before I see the patient, I would always make sure that I have this information available already. So I would say, Mr. or Mrs. A, you are getting this amputation at the transtibial level due to relentless pain. Then I would explain the rigid removable dressing, or the RRD. Within 4 hours of the amputation, a prosthetist will see you to apply a rigid removable dressing, or an RRD. This is a plaster cast molded to your stump. This is to protect your stump from physical injury. For example, while patients are learning to use a wheelchair, they may inadvertently knock their residuum against furniture. The RRD minimizes the chance of the wound splitting open. The RRD also controls the residuum's volume and therefore pain or tension across the wound. The RRD also shapes the stump in preparation for you to wear a prosthesis. Delaying wearing the RRD can potentially delay fitting of a prosthesis. Phantom limb sensation. Phantom limb sensation and pain are very common after amputation. It occurs because the brain still has memory of the leg. It can be managed with simple strategies like massage and tapping the stump. Please ask your clinician to show you how before attempting this yourself. Phantom limb pain. Phantom limb pain is the sensation of pain in the absent limb. In addition to stump massage and tapping, phantom limb pain can be managed with medications. Please let your doctor know if you experience this. Phantom limb pain and sensation usually subside within a year post-amputation, and that's not bad considering your brain has X number of years of memory of the limb. The next thing is wound massage. To ensure that the surgical scar does not adhere to the underlying bone, we recommend that it is massaged gently for 2 minutes every 2 hours during waking hours. However, please do not attempt this until you're shown how to do this. Wheelchair and a wheelchair-friendly home. After an amputation, every patient needs to own a wheelchair, even if they eventually train to walk with a prosthesis. And this is because there may be times when the prosthesis needs to be taken away for repair or adjustment, or a new wound may develop on the stump, and the skin will need to be rested for the wound to heal. During these rare occasions, the wheelchair will give you the means of getting around. As such, your home will also need to be wheelchair accessible, and an OT will help you with that. Driving. Immediately after the amputation, you cannot drive. Your medical condition will be notified to the Department of Transport and Infrastructure, and this will likely result in suspension of your driver's license. In due course, the rehabilitation team will facilitate your return to drive if you are able to. Getting you home. You can only be casted for prostheses once the wound has healed. The earliest this can happen is 6 weeks after the amputation, provided there are no issues with the wound or the residuum. For most people, it takes much longer than 6 weeks. So the goal of your inpatient stay will be to get you home functioning independently from a wheelchair. Your prosthetic training will happen as an outpatient once your wound has healed. If you're able to function independently from a wheelchair, but your home is not yet wheelchair friendly, you will wait at another facility until your home modifications are completed. Prosthetic training. Once your wound has completely healed, the prosthetist will cast you for a prosthesis. Once a cast is taken off your residuum, it takes about 1 week for the prosthesis to be manufactured. Once your prosthesis is ready, you can commence prosthetic training with a physiotherapist. You will be given the prosthesis to take home once you are safely and independently walking with it. Metabolic demand of prosthetic walking. It consumes more energy to walk with a prosthesis than walking with a healthy native leg. Therefore, not everyone returns to the function they desire, but provided you remain medically stable and with commitment from yourself, we may be able to get you close. For example, you may be able to walk the distance you desire, but it may take you longer, or you may need to use a walking aid, or you may need to take an extra rest along the way. Functional progress. The time it takes to be independently using a prosthesis varies from weeks to long months. In general, your function and progress after amputation can be anticipated by your function pre-amputation. It is expected that your function will be lower than pre-amputation level immediately after your amputation because you've just lost a limb. Otherwise, if you last walked 6 months ago, you probably have lost a lot of condition or fitness, and you will probably take short to long months to return to a similar level of function, provided you participate well in your rehab program. If you develop medical problems along the way, this can interfere with your progress. On the other hand, if you are walking well immediately before your amputation, in the absence of complications, you will likely walk independently again within weeks. Interim prosthesis. Your first prosthesis will be called your interim prosthesis. This prosthesis is funded by the hospital. Your interim prosthesis represents your trial and error prosthesis, and you can expect frequent changes to accommodate your physical and functional changes. For example, volume fluctuation of the residual limb, your physical fitness, your balance, etc. Definitive prosthesis. Once you no longer need significant adjustments to your prosthesis, you will be casted for a definitive prosthesis. This is usually 9 to 12 months post-amputation. The definitive prosthesis is funded by SALS, or South Australian Artificial Limb Scheme, if you're 65 and over, or the NDIS if you're 64 and under. These schemes will fund a new prosthetic limb every 2 to 5 years. Follow-up. Once you're discharged from hospital, your needs related to the amputation will be addressed in amputee clinic. I hope you found this video helpful. Thank you for your attention.